breathing is the next strategy we're going to talk about as a way to help with our necks. So why is breathing so important? So breathing is important because when we breathe, we use a lot of different muscles to breathe. But when we use a lot of, we call compensatory muscles to breathe, then we end up using muscles that attach to our neck that end up putting undue stress on our neck and our shoulder and this whole region. So the primary breathing muscle is a muscle called the diaphragm, which is underneath the ribs, kind of inside your trunk, under the ribs, deep inside the trunk, and it's kind of in this plane. So it's not, you can't see it with your eyes from the outside. So that's the primary muscle that's actually increasing the space for your lungs. And what happens when we don't use our diaphragm is we use the muscles in our neck. And because we expand our chest from up here and we breathe like this, and you can visibly see the muscles here contracting. And what happens when we contract the muscles here, these muscles up in here are attached to the bones in the neck. And when I contract these muscles in the neck, then that causes some compression in these joints of the neck. So if I don't need to cause that compression in the neck, then I shouldn't have to. So if I maximally use my diaphragm to do all the breathing, then I can kind of start to relax these neck muscles. When we overuse them to breathe like that, then we get all this tension here and all this tension, and that's where most people hold a lot of tension, causes more compression in the neck joints, and just kind of keeps overusing those neck muscles. We need those neck muscles for other things. So, simple way to start learning how to diaphragmatic breathe is to one hand on the chest, one hand on the belly. So the strange thing, or kind of uncomfortable, awkward feeling thing about trying to diaphragmatic breathe is that when you contract the muscle and you breathe in, your belly actually sticks out. So the goal with the breathing is to try to make the hand that's on your belly stick out and the hand that's on your chest not rise up. So I'm going to breathe in. Trying to feel my lower hand move a little bit. And trying not to get too much movement up here. If I feel like they're both going, then I need to quiet the top end, relax my shoulders, vertically lengthen, and then try again. Breathe in. Belly comes out. Breathe out. I'm going to show the same thing laying down. It's probably easiest to start laying down because there's not anything else to think about. So if I start in a comfortable position here, again, one hand by the belly button, one hand on the chest. As I breathe in, I want to make this hand rise up. I'm going to breathe in. If you do it nice and slow, you can kind of sense the actual, because there's a sensation under the ribs inside the trunk, and that's the muscle contracting. In. Out. So this is a technique to help general relaxation as well. So it reduces tension, can reduce your heart rate, it's a calming technique. So we can get the benefits of calming as well as the benefits of reducing the tension in the neck muscles in the context of this class to reduce the neck muscle activity to take pressure off of the joints in the neck.